Well, good morning if you're on the East Coast of the United States. My name is Robert. I'm the editor of the website OutbreakNewsToday.com. And what I'm going to try to do is do a Facebook Live on Saturdays just to talk about a couple of key topics of the a recap of the week and take a look at some of those hotter stories and just things that I'm interested in. Hopefully you're interested in too. And if you're not on the East Coast of the United States or wherever you are, go ahead and please go ahead and comment. Let me know where you're watching from. I'd really appreciate to know where people are watching from. And the three things I want to look at today are, of course, the hot topic is the novel coronavirus. So I'm just going to go over some information that I've learned over the course of the week. I want to talk about flu is a big deal in the U.S. this year and other countries, of course. But I want to take a look at a couple of surveys that came out in the past week or so that give us some discouraging information concerning people's views on vaccinations. So I want to take a look at that. And the other big story, in my view, was in the Philippines. They reported 4 more vaccine-derived poliovirus cases in that country. And I'm going to just talk about some of the details there and some interesting parts of what's going on there. And some of the things that at OutbreakNewsToday.com that we're looking at, trying to get some more details on some potentially very important stories. So anyway, let me go ahead and start out with the novel coronavirus. And there's been a lot of news coming out about that. It's very, very fluid. And yesterday, a lot of it was really summed up. The CDC did a press telebriefing. So I listened in on that. Couldn't get any questions in. Of course, they take all the large media outlets first, and then time runs out. So I didn't get a chance to ask any questions. However, some information did come out, and I want to go ahead and share some of that with you in case you weren't aware. And the person that kind of ran the telebriefing, her name is Dr. Nancy Messonnier. She is the director of the CDC's National Center for Immunization and Respiratory Diseases. And there was also a Dr. Marty Centron there. He's the CDC's Division of Global Migration and Quarantine, and he has some very specific stuff to talk about also. But I just want to go over a little bit about what they said. And Dr. Messonnier said, the outbreaks of new diseases among people are always a public health concern. And while the discovery of a new virus can be exciting, we are still learning about it. This means our recommendations will continue to evolve as we learn more about the virus. But of course, the novel coronavirus, we've seen novel coronaviruses in the past that infect humans. These are typically viruses that infect humans, typically via animals. And we saw this back in, 2003 or so, 2002. I can't remember the exact year with SARS. And then that was over in Asia, and it really spread through a whole bunch of countries. And then we saw MERS coronavirus pop up for the first time in 2012 in Saudi Arabia. And about 27 countries have seen MERS since that time. Anyway, what she says is, on December 30th, China reported an outbreak of a respiratory disease in Wuhan city. This is a major transportation hub about 700 miles south of Beijing, with a population of more than 11 million. So here's a city that most of us never even heard of before. And that just gives you an idea of the population of China, how massive it is. This city that many of us never even heard of prior to this outbreak has a population of 11 million. An investigation led by local officials identified a new coronavirus as the cause of an outbreak. And as I kind of mentioned, coronaviruses are a large family of viruses that cause illness in people and others that circulate among animals, including camels, cats, and bats. Rarely, animal coronaviruses can evolve and infect people and spread between people. Now, we have seen that previously, even in the more recent MERS outbreak, there is some human-to-human transmission. Regarding the source, most of the patients in the outbreak have reportedly had some link to a large seafood and live animal market. So that does suggest an animal to human spread. They still have not pinpointed what animal this is coming from, but it's pretty sure it's something from this live market in Wuhan, China. Now, the market was closed on, I think it was January 1st, for disinfection and cleaning. The latest numbers out of Wuhan, and they just reported 4 additional cases on Friday, on yesterday. So it's 45 cases, that's what we know of, that are positive for this novel coronavirus. 2 people have died. Both of them were elderly people. One for sure had very severe underlying health conditions. And I think 5 are still hospitalized with, severe enough to require hospitalization. So we'll continue keeping an eye on that. And also, we've also seen it spread during the course of the week outside of China, right? First, we saw a case in Thailand, and then we saw a case in Japan, like the next day, I think. And then again, yesterday, we saw a second case in Thailand. And some interesting stuff about these cases, none of these cases, the 2 Thailand or the Japan case, actually visited this live seafood and live animal market in Wuhan. So that's curious, right? It's also important to note that these patients were discovered in their home country based on testing in Thailand and Japan. All right, let me go ahead and leave that alone for now, and also mention that it really hasn't been spreading throughout China until we got some reports, though, that came out of the South China Morning Post yesterday or today, and it says 3 separate sources have told the South China Morning Post that at least 2 suspected cases, not confirmed, suspected cases have been reported in the South China city of Shenzhen, and a 3rd in Shanghai in the east of the country. The 2 people in Shenzhen are currently in quarantine at the 3rd People's Hospital, which specializes in the treatment of infectious diseases. A medical source said a person suspected of having been infected was being treated in Shanghai, but there was nobody really elaborated on that. So there hasn't been any confirmed cases yet in other parts of China. However, there are some suspected cases being investigated as we speak. And there's suspected cases being investigated in some other countries. I've gone to Singapore Ministry of Health. They almost on a daily basis are seeing suspected cases. And I'm sure you're going to see a lot more of this as this outbreak continues. Some big news that came out on Friday from the United States CDC is they're going to start, they started actually last night, public health screening at 3 major U.S. airports for the novel coronavirus. And here's the statement that came out of the CDC if you haven't seen it already. Starting January 17th, travelers from Wuhan to the United States will undergo entry screening for symptoms associated with the 2019 novel coronavirus at 3 U.S. airports that receive most of the travelers from Wuhan: San Francisco, JFK in New York, and LAX, Los Angeles. San Francisco Airport and JFK both receive direct flights from Wuhan, and the amount of passengers that come in from Wuhan on an annual basis in the United States is in the tens of thousands, something you would never even think of prior to this. So there's a lot of people that travel here from Wuhan. And of course, they included LAX just because there's so many connecting flights and stuff that come out of Asia that come into Los Angeles. The CDC does say, based on current information, the risk to the American public is currently deemed to be low, and that's not surprising. And the CDC is deploying 100 additional staff members to these 3 airports to support existing staff at the quarantine stations at these airports. So, yeah, so the CDC is taking it pretty seriously. And they also issued a HAN yesterday, right? A health alert network that primarily goes out to public health officials in the states. But they did mention this is the criteria they're going to be using to evaluating patients under investigation, or PUIs, for the novel coronavirus. The patients in the United States who meet the following criteria should be evaluated as a PUI in association with this outbreak in Wuhan. 1, fever and symptoms of lower respiratory illness in the last 14 days before symptom onset. If they had a history of travel from Wuhan City, China, or if they had close contact with a person who is under investigation for the 2019 novel coronavirus while that person was ill. So that's the one category. The second one is fever or symptoms of lower respiratory illness, right? We're talking about cough and shortness of breath. These are the most common symptoms seen with the 2019 novel coronavirus. And by the way, it won't be called the novel coronavirus forever, right? I remember in 2012, before they called it the Middle East respiratory syndrome coronavirus. It was called the novel coronavirus then also. So this will get a name change probably in short order. All right, fever or symptoms of lower respiratory illness in the last 14 days before symptom onset with close contact with an ill laboratory confirmed novel coronavirus patient. So these are the 2 categories that the CDC will be looking at to guide evaluation of patients in the airports. So that's all very interesting, and you can all check that out on the CDC website. It's readily available if you want to get more on that. And I do believe, I haven't really confirmed it, but I believe Wuhan is now also testing patients as they leave the airport, as they get ready to board on planes. So that should help out also. I haven't confirmed that, but I've heard as such. So the world is really taking this pretty seriously, and I've seen a lot of countries have put out travel advisories concerning this. Some of the, I follow a lot of virologists on Twitter, and some of them have put out some information about the genome of this virus, and I've seen numbers as high as 89% close to the SARS coronavirus. So that's what we know so far, but there's a lot more coming, and I have no doubt. The next topic I want to go ahead and talk about is flu in the United States, and it's been a heavy flu season. It really started out strong with influenza B, which you don't normally see early on in the flu season. But right now, the CDC says that while the overall percent of specimens positive for influenza declined nationally in the last week, the percent of positive for influenza A viruses increased. In some regions, they're starting to see an increase in the proportion of H1N1 influenza viruses compared to the other viruses. They say it's too early to know whether the season has peaked or if flu activity will increase again. So they did see a small decline, but it's still overall across the country, it's still, flu activity still remains high, still remains elevated. Here are some of the estimates. These are estimates, of course. CDC estimates that so far this season, there have been at least 13 million flu illnesses in the United States, over 120,000 hospitalizations, and 6,600 flu fatalities. And again, those are all estimates. And there's been no data out yet concerning the effectiveness of the flu vaccine, the 2019-2020 flu vaccine this year. But I mean, as you say every time, that getting the flu vaccine is better than not getting the flu vaccine, if the percentage of efficacy is still low, it's still better because it could reduce your symptoms and like that. So something to definitely be concerned about. So those are pretty high numbers as far as estimates. There's a couple. Then there was a couple of surveys that came out during the course of the week, and I don't know if you guys have seen these or not, especially if you're in the U.S. And one is, it's a Gallup survey. It says fewer in the U.S. continue to see vaccines as important. Okay, well that's a little troubling, right? And kind of. This is a summary from CIDRAP. CIDRAP summarized these surveys, so I didn't have to go through the whole survey and highlight it all. But this is their summary of what the survey said. This Gallup survey says it shows that only 84% of Americans view vaccinating children as extremely important. This is down from 94% in 2001. Even more troubling, only 45% of polled Americans say vaccines do not cause autism. 45%. The Gallup survey was conducted the first couple of weeks of December of last year, only a few months after the U.S. narrowly avoided losing its measles elimination status after a record-breaking year with outbreaks in New York, New Jersey, and Washington State, among other places, right? There was well over 1,200 measles cases last year, which was the most seen in, 27 years, I think 1992, right? So it was a big deal. Quote, the decline in Americans' belief in the importance of vaccinating children between 2001 and 2015 occurred among almost all subgroups of the U.S. public. Since then, attitudes have been fairly flat by gender, age, education, and party ID, Gallup said in a press release. The only group that has maintained its 2001 level of support for vaccines is highly educated Americans, those with postgraduate degrees. Now, 90% of Americans with postgraduate degrees in 2019 believe vaccinating is extremely important, a percentage unchanged since the beginning of the millennia. 2001, only 39% of Americans polled said they heard a great deal or a fair amount about the possible disadvantages of vaccines. In 2019, that percentage rose to 79%. Currently, 11% of U.S. adults think vaccines are more dangerous than the disease they prevent. 11% of Americans think that the MMR is more dangerous than measles, mumps, or rubella. The link between autism and vaccines, which has been thoroughly debunked by scores of major studies over the past 2 decades, is still a concern for many Americans. 46% of Americans polled, down from 52% just 4 years ago, say they are unsure if vaccines cause autism. There's been and they're right, they're absolutely right. There's been a lot of studies coming out all the time debunking the Wakefield study, basically. 10% say they do cause autism compared to 6% in 2015. So more people think that, more Americans think that vaccines cause autism than they did 4 years ago. So that's pretty bad. And then there was another study, and this was commissioned by the American Academy of Family Physicians, that say that millennials are least likely to get the flu vaccine. So let me take a look at a summary of that and see what they have to say. The new survey commissioned by the American Academy of Family Physicians shows that millennials, adults in their 30s and 20s, were the least likely to get a flu shot and more likely to agree with the anti-vaccine statements than other age groups. So that's quite troubling, right? The survey aimed to investigate the impact of myths and misconceptions about the flu among adults ages 25 to 73. And show that more than 80% of Americans incorrectly answered at least one in a series of questions about the flu. Roughly a third of the survey participants got all the questions wrong. I mean, it's not as if this information is not available. So it's hard to imagine that 33% of survey participants got all questions wrong concerning the flu. And this survey was also conducted around the same time, right around between Thanksgiving and the end of the first week of December. The survey also found that African Americans were more likely to agree with anti-vaccine rhetoric, and that men were less likely than women to get the flu shot for themselves or their children. And it says 55% of millennials surveyed said they have not gotten a flu shot, with 33% saying they do not intend to. 61% of millennials surveyed said they are at least partially agreed with some of the anti-vaccine rhetoric, compared to only 42% of baby boomers who agree with the anti-vaccine rhetoric that's found on blogs and on sites all over social media. So pretty troubling news concerning Americans' view of vaccinations. And we see the outcome, right? We saw the outcome last year with measles. And it looks pretty bad concerning the flu, for the flu shot also. Now, the last major topic I want to talk about on this Facebook Live show is polio, right? We've seen a lot of polio in 2019. The numbers rose dramatically, both for wild polio virus and also for the vaccine, circulating vaccine-derived polio virus. The wild polio virus, which many were thinking that might be eradicated like any year now, maybe rethinking that as things really went wrong in Pakistan in 2019, where like 135 cases were reported as compared to, a dozen or two in 2018. So that really was a bad situation. Then there's circulating vaccine-derived polio viruses. We saw about a doubling, like from like 100 and something to 200 and something cases in 2019, and an increase in the number of countries that are reporting it. The countries reporting these kind of polio viruses are primarily in Africa, and we saw some more countries in Asia report cases of circulating vaccine-derived polio virus. And one country that has been hit pretty hard by this, and they were really hit hard by a lot of infectious diseases in 2019, is the Philippines, right? We saw a dengue fever outbreak somewhere around 450,000 cases and more than 1,500 fatalities, which is double what they saw last year or in 2018. We saw increase in diphtheria cases. We saw measles cases, particularly in the beginning of 2019, really skyrocket in the beginning and ending up slowing down toward the end of the year to about 45 to 50,000 cases. So it was a bad year for infectious diseases. And then in September, the first vaccine-derived polio virus was reported. And I don't think the Philippines has seen polio in about 2 decades. So that was pretty troubling. But this is the latest news out of the Philippines concerning that. It says the Philippines Department of Health reported today the confirmation of 4 more polio cases in the country, which is bringing the total number of vaccine-derived polio viruses. And the Philippines has seen both vaccine-derived polio virus 1 and 2 in the country. So it's now 16 cases since the outbreak started in September. Now, the new cases are 2 additional cases out of, and excuse me if I don't pronounce this right, Maguindanao, that's in Mindanao. Most of the cases have been reported in Mindanao. If you're not familiar with the country, it's a archipelago of about 7,000 plus islands. And it's broken down to 3 main regions. And the regions are Luzon in the top, and that's where the capital of Metro Manila is. The Visayas are a group of islands in the middle, and then Mindanao is a giant island down at the bottom. So the bulk of these cases have been reported out of Mindanao. So we had 2 children, ages 2 and 3, both boys, out of Maguindanao. Hopefully I'm saying that right. I'm probably not. One case out of Sultan Kudarat, which was a two-year-old boy. And interestingly, one case out of Quezon City. And this is right out of Metro Manila. Quezon City is part of Metro Manila. And that was a 3-year-old boy. Now, not a total surprise, though, because if you've been keeping close eye on the polio situation in the Philippines, the environmental sampling out of the Metro Manila area has seen well over a dozen positive cases in the water and the environmental samples. But this is, as far as I can tell, this is the first case of a human infection in the Metro Manila area. So, and I just want to point out one interesting part about that case out of Quezon City. And this is a report out of the Sun Star. This is a Philippine news source. And it says the Department of Health on Friday, January 17th, disclosed that the 3-year-old boy afflicted with the polio virus in Quezon City has been found to have an impaired immune system. In an interview, DOH Undersecretary Eric Domingo said, excuse me, that they have received a report that the first patient from Metro Manila is immunocompromised, which makes him vulnerable to diseases despite getting a complete dose of oral polio vaccine. Excuse me. The child is immunocompromised. He has several illnesses. Probably this is why he was easily afflicted with the virus. He was not able to mount an adequate immune response during the vaccination, according to Dr. Domingo. So that's the 3 big stories I wanted to talk about, and it's very, very troubling. And there's actually some parts of the Philippines where, and it sounds kind of strange to Americans, but they are banning public defecation now in some areas where apparently that happens quite frequently. So that's troubling news out of that country, where they're having a lot of infectious disease problems and environmental problems, right? The Taal volcano is quite a menace right now, and they also experience so many typhoons, which we call hurricanes here in the United States. And the last thing I want to talk about is some of the things that we're covering on OutbreakNewsToday.com, which we're trying to get more information to give you some more concrete information concerning some of these news stories, which are coming out of news media in these foreign countries, foreign to the United States. One is in Djibouti. Djibouti is a small African country on the Horn of Africa in East Africa, right next to Ethiopia in that area. And there are reports coming out of there, though I can't find anything official, of quite a large chikungunya outbreak. And so we're trying to dig up some more information on that. But they're battling that. And it's not I don't think it's a big surprise, because neighboring Ethiopia saw well over 50,000 chikungunya cases last year, which is a lot. And another story that we're taking a look at is I saw in some local media reports out of Dhaka, Bangladesh, that they have a Nipah virus case in there. And I've tried to contact the IEDCR out of Dhaka to see if I can get some confirmation on that. But I have published reports linking to these media reports. There's been more than one. But of course, Nipah virus, again, this is a big issue. And this has been a big scourge on Bangladesh over the past 20 years. And it's a very, very dangerous virus if you're not familiar with it. And that's basically everything I got. I appreciate you watching. I'm going to try to do this every Saturday. Of course, I can't promise that. And hopefully give you an update on some of the more pressing stories, more interesting stories that are going on in the world of infectious diseases. And of course, I encourage you to check out the website, OutbreakNewsToday.com. And of course, you're on Infectious Disease News, the Facebook page, and that's kind of our sister site. So I post a lot of the stuff on OutbreakNewsToday.com on this Facebook page, Infectious Disease News. But I also try to post some other stuff. I probably should do more other stuff, but it's hard to find the time to do everything. And I also encourage you to check out the YouTube page, Outbreak News TV. I'm trying to get that growing. And also we have the podcast. That's Outbreak News Interviews, which is found on Apple Podcasts, Stitcher Radio, and Spotify, among other platforms. So again, thanks for watching, and I'll see you next Saturday for another update. Thanks.